Welcome, everyone. My name is Dr. Lesliam Quirós-Alcalá, and in this module, we will be focusing on women in the workforce. Specifically, we will be discussing some of their unique workplace health risks. For the present module, here are the learning objectives. Please take a moment to pause the lecture and review them at your own pace. So before diving a little deeper on women as a vulnerable workforce, let's first talk about a few demographics on women, predominantly in the U.S. labor force. As a disclaimer, I do want to preface this lecture by letting you know that most of the statistics provided in this lecture are U.S.-centric and remind you that you should always access the most recent and up-to-date statistics, a lot of which are available on the U.S. Bureau of Labor Statistics, or BLS, website. So first, let's talk about women in the U.S. workforce, in particular about labor force participation by sex. The labor force participation rate represents the percentage of persons in the civilian, non-institutional population who are 16 years of age and older that are also employed or actively looking for work, where non-institutional population refers to civilians who do not live in institutions such as mental health facilities or penal institutions, as well as retirement homes, and who are not on active duty in the armed forces. So according to data from the U.S. Bureau of Labor Statistics, or BLS, we have seen a steady rise in the number of women in the workforce that parallels trends among men over the last few decades. However, there are still more men in the workforce than females, as depicted in the top figure. Now, when we consider the share of the civilian labor force, in other words, among those in the labor force, the percentage of men and women in the labor force is still comparable. Similarly, worldwide, according to data from the ILO, or International Labor Organization, the global labor force participation rate for women is just under 50%, while for men, it's about 70%. The ILO, or International Labor Organization, is a United Nations organization which aims to bring together governments, employers, and workers of over 180 member states in order to set labor standards as well as develop policies and programs that promote decent work for all women and men. Now, the labor force participation rate among women with children, or working mothers, has also increased over the years. As seen by the top line, or orange line on the top of this figure, we can see that over 70% of working mothers have a child between the ages of 6 and 17 years of age, and slightly lower percentage rate is seen for working mothers with children that are 6 years of age or younger. Now, by age, we can see that most women in the U.S. workforce are between the ages of 25 to 54 years of age. This group includes women of reproductive age. Now, according to the Centers for Disease Control and Prevention, or CDC, women between the ages of 15 and 44 are considered to be of reproductive age. Now, let's talk about women in the U.S. workforce by occupation and industry. By occupation, a little over half of women in the labor force hold jobs in management and professional unrelated occupations. By industry, women account for more than half of all workers within several sectors, including education and health services, as well as other services, which includes repair and maintenance industries, personal and laundry services, membership associations and organizations, as well as private households and other jobs in the service sector. Still, we do see that women are substantially underrepresented relative to their share of total employment in several sectors, including in manufacturing, agriculture, transportation and utilities, mining, and construction. So this over- and underrepresentation of women in different labor sectors inevitably results in different levels of exposure by gender to varying workplace hazards, which we will discuss later. So with regards to unemployment rates, among women in the United States who are 16 years of age and older, unemployment rates are estimated to be slightly under 10%. These unemployment rates are highest among women of color, including Black and Hispanic women, and in terms of education, we do see that it is estimated that close to 50% of women have a college degree or additional graduate degrees. We also know that close to 3 million women with disabilities and about 1.1 million women in the armed forces participate in the labor workforce in the United States. Now, it is also recognized that there are disparities based on working wages by gender. So in the United States, according to the Bureau of Labor Statistics, or BLS, among people who are in the labor force for at least a little over 6 months, or 27 weeks, we do see that there are more women than men living below the official poverty level. Specifically, it is estimated that close to 4 million women, compared to a little over 3 million men, live below the official poverty level. Now, the working poor rate, in other words, the ratio of the working poor to all individuals who were in the labor force for at least 6 months, is also reported to be higher in women compared to men. We do also see that racial and ethnic disparities in wages are also prevalent. Specifically, Black and Hispanic women are reported to be more likely to be among the working poor compared to white or Asian women. So in summary, we learned that most women in the labor force are between 25 and 54 years of age, which does include women of reproductive age. We also learned that a large percentage of these women in the labor force are working mothers with children under the age of 18 years. Additionally, we learned that disparities in wages based on gender also exist, with men still earning more than women, and that there is also gender segregation in the labor market that is prevalent, whereby horizontal and vertical segregation in the labor market exposes women and men to different hazards. For example, there are more women in healthcare, education, and childcare sector, while there are more men in construction, transportation, and agriculture, which translates into different workplace exposure hazards. And lastly, there are racial and ethnic disparities in unemployment and wages, with Black and Hispanic women earning less than white and Asian women.